Every single day we receive lots of emails from worried new moms who want to know, are these physical problems that I'm experiencing after my delivery normal? Right. So we decided to record this video for you in order to help you understand which physical problems are normal and when to call a doctor.
Yes. So in this video, we are first going to talk about 10 physical problems that you can expect during the days and weeks after your delivery, no matter if you had a vaginal delivery or a C-section. And of course, we're also going to tell you exactly what you can do about them.
Yeah, and then finally, we're also going to briefly talk about the signs and symptoms that are not normal and why you should call a doctor when you experience them.
Yes. I am Nathalie, a pregnancy and birth consultant and TCM therapist.
And I am Mathias, a researcher in Science Geek, and we are here to help you and your baby naturally and science-based. We've got a lot to cover, let's jump right into it.
Alright, so the first problem that you're gonna experience, particularly over the first couple of days after your delivery, is a very heavy bloody vaginal discharge called lochia. Lokia is basically the result of your uterus shrinking back to its original size. So your body gets rid of all the superficial mucous membrane from your uterus that it no longer needs now that your baby was born.
Yes, and because of that, your vaginal discharge is going to be a mix of that mucus as well as tissue debris and blood.
Right.
Again, that discharge is going to be very intense over the first couple of days, but after about a week, it's going to become increasingly watery and more brownish. Mm-hmm. However, you can expect the discharge to continue over the first few weeks after birth.
Yeah, and by the way, one thing that you may also notice is that the bleeding is becoming heavier when you breastfeed. Well, that's because breastfeeding can make your womb contract because of the oxytocin that is being released during breastfeeding.
Right. By the way, during the first 6 weeks, you should not be using any tampons because they can increase the risk of an infection. Instead, you're going to need super absorbent sanitary towels that you also need to prep in a way that we are going to show you later in this video.
That's right. A final word on lochia. It's important that you observe your discharge and yourself thoroughly during the first 2 weeks after delivery. If you're losing blood in large clots, if you're soaking more than one pad in less than 1 hour, or if your bleeding is accompanied by symptoms like fever, tenderness, pelvic pain, or strong headaches that don't go away, please call your doctor.
Yeah.
Also, if you're unsure whether or not you should make the call, please don't feel embarrassed. Do make the call. It's always the right thing to do.
That's right. The second problem that most women experience after a delivery are period-like pains. Some even say they feel like mild contractions. Well, believe it or not, but what you are feeling are in fact uterine contractions, which are necessary so that your uterus can shrink back to its original size. They are caused by the same hormone called oxytocin that can also make your vaginal discharge heavier. And since nipple stimulation can release oxytocin, you're most likely going to feel more of these period or contraction-like pains while you breastfeed your baby.
Exactly. The good news is, normally they disappear over the first few days after delivery. But if these period-like pains are too uncomfortable for you, then you can get some pain relief. However, you need to call your midwife because any means of pain relief need to be tailored to your specific needs based on the kind of the delivery you had.
Right. Talking about period-like pains, many women are concerned because their period has not restarted yet, even weeks after giving birth to their baby. So when can you expect your period to come back then?
Well, it's quite difficult to tell when it's gonna happen because, as always, every woman is different. But basically, it depends a little bit on if you're breastfeeding or not. If you bottle feed your baby or when you combine breastfeeding and bottle feeding, then your period could come back some 5 to 6 weeks after you gave birth to your baby.
Yes. However, when you only breastfeed your baby, your period may only come back once you start to reduce breastfeeding.
Right.
But keep in mind that this does not mean that you cannot get pregnant, okay? In fact, you can get pregnant some 3 weeks after your delivery. Some women get pregnant even earlier.
Right.
Oh yes, it can happen. No worries, you can thank me later for this information.
All right. The next problem that you most likely experience after a delivery are problems with your bladder.
Yes, bladder problems are more common after a vaginal birth compared to C-sections because your bladder really goes through a lot during labor and childbirth. But it can also happen after C-sections, even though the causes for bladder problems after C-sections are different.
Right.
However, in general, it is very normal to experience bladder-related problems after a delivery.
Yes. So first of all, you will most likely find it difficult to pass urine. In fact, sometimes women even require a urinary catheter, which is inserted into the bladder to allow the muscles to rest.
Yeah.
So please keep your doctor in the loop in case you find it really difficult to pass urine, and also if you notice an unpleasant smell or if you feel sore. And just that you know, in case you have a C-section or an epidural, you will always get a urinary catheter.
Yes, and second, next to finding it difficult to pass urine, it may also be particularly difficult to control your bladder at this point, which is why it is totally normal to leak a bit of pee when you sneeze, when you laugh, or when you cough, for instance.
Unfortunately.
Or when your partner is tickling you because he's completely unaware of what's gonna happen. Not that I would do such a thing, right?
Of course.
Just saying.
Yeah. Well, it's probably a good idea for your partner to watch this video too.
Yeah, probably,
Same.
yeah.
Anyways, one thing that can help a lot here are pelvic floor exercises. In fact, you can do this as soon as you feel comfortable with it after your delivery, even after a C-section. So either lie on your back or sit down. Next, squeeze and draw in the muscles around your bottom as if you are holding in gas. Then squeeze the muscles around your vagina and bladder as if you are holding back urine. Hold tension for a couple of seconds and then relax gradually. Repeat this exercise 10 times per session and repeat one session 3 times per day.
Right, by the way, over this first couple of days after birth, you may also find it difficult to pass stools.
Right.
But if you do feel the urge to pass stools, then it is really important that you're not holding back. We know that many women do, right? Because they're so afraid of going to the toilet after birth, particularly if they're having stitches. But the problem is that if you're holding back, you don't solve the problem, you just postpone it until it does become a problem.
Yeah, exactly. In fact, over the first few days, it's really important not to let yourself get constipated. And because of that, it's really important to drink plenty of water, eat lots of fresh fruit and vegetables, and products which contain lots of fiber, particularly if you find it difficult to pass stools initially.
Yeah.
If you are constipated and it's not going away, please talk to your midwife because then you might need some mild laxatives.
Yes. By the way, another nasty problem that you may experience when you go on the toilet, even after C-section by the way, are piles. It's just very common after birth, but the good news is that they normally disappear after a couple of days. And they're just another reason why it's very important not to get constipated, right? Because when you strain, they get worse. So do make sure that you eat lots of fresh fruits and vegetables and that you drink plenty of water.
Exactly. The next problem that you most likely experience is a problem that you normally only have after vaginal birth, but not after a C-section, unless maybe when it was an emergency C-section.
Yeah.
And that problem is perineal pain. Now, obviously, perineal pain is totally normal after vaginal birth, particularly if you have stitches. Don't be concerned that the stitches won't hold. They will hold. They are made for that.
Right.
But it is important that you have a bath with plain water or a shower every day to keep the area clean and then just pat the area dry.
Yeah, by the way, if you need painkillers, please check with your midwife first, particularly if you're breastfeeding. And then one thing that we recommend to all women at the clinic for the days after birth is this. First of all, buy yourself some super absorbent sanitary towels. Second, prep them with something that contains witch hazel. But don't worry, there are many different products available that you could use. In fact, we will link to some products that we are using in the description below this video.
Right.
And by the way, if you're living in the German-speaking area, this is the product that you want to use, Ritterspitz. It's the best product that you can get in order to heal the whole area down there.
Yeah.
By the way, they also ship into other European countries, but don't worry, there are lots of other great products available.
And then if your product comes in a spray bottle, simply spray the liquid on the pad. If it does not come in a spray bottle, just use 1 or 2 tablespoons full of the liquid and put it on the center of the pad. And then afterwards, put the pad into the freezer. Just prep some pads so that you have them readily available after delivery. Try it. Trust me, it feels amazing and it's just what you need after delivery. And we also receive so much positive feedback from women who did.
Yeah, that's right. The 8th problem that you are going to experience after childbirth is a lack of milk supply. In fact, I think that that's a very strange problem, right? Because our son was starving. He was so hungry, but all that she gave him was a couple of drops of milk every single day for the first couple of days. I was so close to sharing my pizza with him.
You was even calling me a bad mom.
Yes.
You were joking, right?
No. No, just kidding. No, you're not a bad mom. But the problem is that over the first couple of days, your breasts will only produce a small amount of what is called colostrum. In fact, it's only going to be like 3 or 4 teaspoons full per day.
Exactly. It's a highly concentrated, creamy, yellowish liquid that contains proteins, minerals, water, even maternal antibodies. So basically everything that your baby needs. And then only from about day 3, your breasts start to produce milk in increasing quantities. So don't be surprised if initially those few drops are everything that you have for your baby.
Okay.
Don't worry, your baby will be fine.
Right. The 9th problem that you're likely going to experience after giving birth is called diastasis recti, which is a separation of your stomach muscles. We know it sounds really bad, but it's totally normal because as your uterus and womb grow, they push the muscles apart, which makes them longer and weaker.
Right.
But in most cases, the gap will close within 8 weeks after delivery.
Yes. So how do you check how far apart your muscles are? Well, first of all, lay on your back with your legs bent. Keep your feet flat on the floor. Then raise your shoulders slightly and look down at your tummy. And then use the tips of your fingers to feel between the edges of your muscles below and above your belly button. It's not that simple because obviously there is also going to be lots of belly fat at this point. However, you're obviously not looking for that belly fat, but for your abs. This is what your abs would normally look like, but again, if they were separated, you would feel a gap in between them. And just that you know, that gap can be quite substantial right after birth. There are women who can fit as many as 10 fingers in between their muscles, so don't be scared. So again, check how many fingers you can fit. Write it down and do this regularly throughout the first 8 weeks after you gave birth in order to see if the gap is getting smaller. If it does not get smaller, or if you can still fit 1 or 2 fingers between your muscles some 8 weeks after your pregnancy, please call your doctor. Don't be worried, all they're gonna do is refer you to an expert for postpartum exercises.
Yes, and by the way, you can also start with these exercises as soon as you have the approval from your doctor to exercise after birth, which depends a little bit on the kind of delivery you had. In fact, there are really great exercises that you can do if you experience a separation of your abdominal muscles. However, please understand that we really need to explain them in a separate video, as this is really a huge topic.
Exactly. And then the 10th problem may sound so trivial, but it's really something that seems to concern so many new moms. And that's hair loss after birth.
Yes, hair loss is just the result of the hormonal changes that you're going through after birth. But we can reassure you, it's normally only a problem for the first 6 months after delivery. And then your hair will continue to grow as it did before your pregnancy.
Now, the final question is, when should you be worried and when should you call a doctor during the first few weeks and in particular during the first few days after delivery? Well, we have already discussed some scenarios under which you would call a doctor, for example, when your vaginal discharge contains large blood clots, right?
Right. What's also important is that if you experience shortness of breath, if you find it difficult to breathe, or if you feel any chest pain or experience seizures, then you should seek emergency help immediately.
And then if you're having a headache that does not get better, if your leg is swollen or red and painful or warm to the touch, or if your incision is not healing, then please call your doctor at your earliest convenience. And finally, during the first week of your delivery, it's also a good idea to check your temperature some 3 to 4 times per day.
Yeah, if your temperature is 100.4 degrees Fahrenheit, which is 38 degrees Celsius or higher, then please call your doctor because fever could point towards an infection.
Remember, if you experience anything during those first few weeks after your delivery that makes you ask yourself, should I call a doctor? Please do make the call. It's always the right thing to do.
Yeah, please don't feel embarrassed. Your well-being is just too important.
Right. If you have found this video helpful, we would be super grateful if you could leave us a like.
Yes, and for more useful tips and tools on pregnancy and baby-related topics, make sure to subscribe to our channel and to hit the bell.